Welcome back to movementprofessional.com. So I'm responding to a question I got regarding a video I did about the Z-sit or 90-90 position for the internally rotated leg. So as a review, the 90-90 would refer to 90 degrees here at this externally rotated hip, 90 degrees here at the internally rotated hip. I also refer to this as a Z-sit position. So the question was about this internally rotated knee. If sitting in this position, I believe the terminology was that it feels like the knee is going to pop out of the socket or dislocate. So discomfort in this knee, too much pressure in this knee. What can we do about that? So first off, I would say, like, if you're feeling that type of threat in your knee, maybe this isn't the position for you right now, but ways that we can kind of work towards this side or work away from this side would be first just put a little bit more pressure through this externally rotated side. So I like to think of this as a continuum because it's always going to be harder to go towards the internally rotated side. All right, so if you have any type of limitation in mobility, you do not want to force this side yet. So you start with your body facing the externally rotated side, and you can do a lot right from this position. So I'm usually going to start with my hands and framing this knee, chest facing this externally rotated leg. And then I'm just going to start to think about some isometrics for this side. So if I want to promote internal rotation, eventually I'm going to have to start thinking about this knee coming in towards the groin. I actually want to think about internal rotation from my pelvic bone here. So I want to think about this bony prominence moving more inward and compressing inward. So I can do that while I'm facing here, and then I won't actually have as much load into the knee. Because if I'm feeling load in the knee, I'm most likely not ready for it. It's just I'm not getting enough internal rotation, so all the force is going to the knee. So I'll start here, and I'll just start thinking about that. Left abs engaged. I can even try to just take my hand, still facing this way, but just take my hand and push it on the calf as if I'm doing a hamstring curl, heel towards butt, and that's going to start engaging some muscles here. I might feel that in my glute, my hamstring, even my inner thigh, but it's all bringing the attention from the knee up towards the groin or towards the hip. And once I feel pretty comfortable with that, I can start moving my hands so I can go from one hand on the outside and one hand on the inside. I start to move my sternum a little bit more to the center. So that's puts a little bit more load through here, but I'm still more biased towards the externally rotated side. And I'm going to do the same thing. So I'm going to start thinking about my left abs. I'm going to start thinking about hamstring curl, so put a little pressure on the calf muscle. Think about the heel going to the butt, or I can think about the knee going into the groin. I always want to stay heavy through the inside of the knee here. That's going to give me some stability through there, but I don't want to necessarily be trying to force my way over. All right, so thinking of this thigh actually getting shorter, knee towards groin, is often a useful cue as long as I keep my knee heavy through there. All right, so once I feel more comfortable here, then I can put my hands on my knees. All right, I'm still kind of trying to turn back towards this left side. All right, as soon as I feel that wonkiness in the knee, that just tells me I'm not ready though, and I can always go back towards here. Over time though, the more you use the abs, the more you're able to use the hamstring, the more you're able to get this compressive motion of knee towards the groin, and think about this hip bone kind of compressing inward. All of that will make it feel like the motion is coming more from the hip and the core and less from the knee. All right, another easy way to regress is just to elevate your butt. So on this 2-inch AirX pad, now everything is just a little bit less loaded here. So I still want to try to keep that knee down, but it's much easier to turn to this left side without as much load through the knee. So that's another simple regression that you can start working on if it's just too uncomfortable in the knee. But you're always wanting to focus on these same isometrics. It's left abs, it's compression through this pelvis, hamstring, inner thigh. Then compress the femur towards the socket while you're maintaining this hip, this knee down, and external rotation. You do all those things, you should be able to get the torque and the tension out of the knee and bring it up more towards the proximal core and hip. Hopefully that makes sense. Hopefully I answered your question. If you have another question, feel free to reach out at movementprofessional.com. I'll see you next time.